So we're here today to talk about the Mitral Foundation and then the award that we received for the Mitral Valve Repair Reference Center. We're one of the unusual places that actually has two surgeons out of this. So I'll tell you a little about the Mitral Foundation. I was one of the founders along with Bob Bono here from Northwestern. It's a group of surgeons and cardiologists, and essentially it was to establish best practices for doing mitral valve repair. We gathered together about 8 years ago. Right now there's about 30 centers in the United States that have a high volume of mitral valve repair and also excellent quality outcomes at 30 days as we're measuring it. To put this in perspective, this is the top 1% of the top 1%. This is kind of the rarefied air. What's unusual is that most centers only have one person that's in it, but we have two. And so Kevin Hodges joined us a few years ago from the Cleveland Clinic, and he brought with us robotics.
I'm really tremendously grateful and honored to be a part of this fantastic group. In bringing robotic cardiac surgery to the mix here at Northwestern, it continues our tradition of excellence in offering all of the spectrum of treatment for mitral valve disease. And when we think about minimally invasive cardiac surgery, our top priority is to make sure that we continue to maintain that standard of excellence, both in terms of mitral valve repair quality and patient outcomes. And so here at Northwestern Medicine, when we think about a patient who has degenerative mitral valve disease or mitral valve prolapse, our approach is to offer them the least invasive option that we can, as long as we maintain our very, very high standard of repair rate, repair quality, and patient safety. And that's really what's reflected in the Mitral Foundation Award. We're using the same tried and true techniques for mitral valve repair, regardless of the approach that we take. And these are techniques that have been really pioneered and perfected by Dr. McCarthy and the long legacy of mitral valve surgeons that he learned from. And when we approach these valves, whether it's robotic or open surgical repair, the foundational philosophy is the same, and we expect that all of these patients are going to have really durable long-term results reflected by the Northwestern experience.
Mitral valve repair is a little tricky. It takes some experience to be able to do this. Across the country, it's somewhere like 70% of the, maybe 80% of the patients that have this type of mitral valve prolapse are able to have the valves repaired. That's better for the patient in the short term, but also in the long term. We're running close to 100%. Those kind of valves are being repaired here. And also we're always focused on safety and effectiveness. And so we're looking now at 10-year results, and we're finding an extremely high rate of freedom from any failure, meaning that the valve doesn't leak late or that they don't need a second procedure or operation even at 10 years. So we're looking forward to Kevin continuing that trend with us, and it's a great center and it's a great award. We really appreciate that.